Hi, I'm Dr. Essa, and if you haven't watched my channel before, I talk about skincare, and before I forget, please subscribe to my channel and hit the notification bell so you can see future videos that I make on skincare and health. So you survived the teenage years when it was sort of acceptable to have a pizza face. You figured out how to get rid of it, and now it's back with a vengeance. There is so much misinformation on acne and large pores. From experience and as a physician, I'm going to tell you 5 mistakes you could be making that is worsening this vicious cycle. And stay tuned until the very end, where I tell the most common mistake people make for their adult acne. If you've ever had a serious case of acne or currently do now, it goes much deeper than that, both physically and mentally. I struggled with acne as a teenager and have close friends that have struggled as an adult. I know the pain of having what seems like an ugly disease visible for everyone to see, right on your face. Acne can be deeper than surface level, causing painful cysts in the deeper layers of your skin that causes scarring and hyperpigmentation. And the cycles of outbreaks can be very agonizing to wake up to every morning, causing serious cases of depression. It can even cause you to develop a poor self-image and perhaps isolate yourself socially. The only things which seem logical to alleviate this problem, such as repeated washing or covering it with heavy makeup, only makes it worse. It seems like a vicious, never-ending cycle that will never go away. I know the frustration. First, I want to tell you a few things which are the most important things to know. These come from the bottom of my heart, as having experienced it myself and as a physician. You are beautiful despite this seriously annoying condition. In most cases, with patience and persistence, it will get better. You don't have to live with it. So what causes adult acne? There are many phases of life as a woman that causes fluctuations in hormones. The change in hormones around your menstrual cycle is one of them. But there are so many times in life that a woman is susceptible to more changes. These include getting pregnant, postpartum, while nursing, premenopause, menopause, and also starting and stopping birth control. These fluctuations in hormones can cause activation of your sebation glands to overproduce oil, which is one of the factors causing acne. Especially as we become more mature, there may be an increase in testosterone and dihydrotestosterone relative to the level of estrogen, which is a driving force for oil production as well. This causes your pores to become clogged, resulting in acne. Another factor is stress. It seems like as we become older, we have more responsibilities, and so the stress level goes up. Stress causes an increase in cortisol, which affects other hormones and therefore can increase oil production. Stress can also increase inflammation in our skin, which can also drive acne. I highly encourage you to manage the stress by talking to someone about it, meditation, prayer, perhaps taking a vacation, or participate in hobbies that you enjoy to relieve this trigger. So let's get into it. There are 5 major mistakes people make when it comes to acne. And stay tuned for the very end, where I give the most important tip for managing adult acne. Number 1 is over-cleansing. I know that when you have acne or enlarged pores, your skin may be excessively oily and you just logically want to remove that oil. What actually happens is that you are stripping the oil so much that it activates your sebaceous glands to produce even more oil and ends up clogging your pores even more. Over-cleansing your skin can actually make your skin overly dry and irritated, which can also be a driving force for acne flares. As a simple rule, you should be washing your face about 1 to 2 times a day, depending on how oily your skin is. I personally wash it twice a day because I just love the feeling of splashing water on my face and starting with a clean palette in the morning, and quickly then apply moisturizer onto my damp face so it doesn't get overly dry. Of course, if you do work out, also, I would recommend to wash your face afterward because the sweat and bacteria leave a good breeding ground for breakouts. As a general rule, the type of wash you should be using should not strip your face of oils. If your face feels tight after you wash it, your cleanser may be too harsh, and so you'll want to find a more gentle cleanser. Your face should feel nice, but not tight after you wash it. Number 2 is not using a moisturizer. This is so important because regardless of your skin type, dry skin, combination skin, oily skin, all need an adequate moisturizer. Drying your skin out will not help with acne or the size of your pores. Your skin will actually be triggered to make more oil again and will clog your pores. Using a gentle moisturizer that agrees with your skin will prevent your pores from getting larger and can help smooth lines and wrinkles and will also prevent future breakouts. The number 3 mistake is not using SPF. So I remember as a teen going out in the sun to sort of like dry out my acne. Since the sun can essentially damage your skin, you can possibly see a slight improvement of your acne for a short time. However, since the sun does trigger melanocytes, which are the pigment producing cells, this can cause your existing acne lesions to become hyperpigmented. This is true especially for darker skinned individuals and can be really tricky of a problem to get rid of. The sun can also damage the collagen in your skin and cause premature wrinkles and aging. It is so important, especially if you do have acne, to wear SPF. Number 4 mistake is rinsing your cleanser off too quickly. So as you've seen in my other videos, one of my favorite products I've mentioned before is salicylic acid. This is very helpful for acne and large pores as well as having anti-aging benefits. The reason it is so great is that it needs very little contact time to work and is effective in a face wash. Since you don't have to leave it on your skin for so long, it causes less irritation than other treatments. It targets your oil glands and suppresses the oil formation and deeply cleans out your pores. It also has antibacterial effects, which actually helps the actual bacteria from growing that contributes to the acne. However, when you do wash your face with it, it is really important to take your time, lather up your skin well for the salicylic acid to take effect. Number 5 mistake is switching your products too often. I know it's tempting when something does not work for a few days to ditch it and find something new. However, when you do this, you are not allowing your skin to get used to the product first and then waiting long enough for it to take effect. It could take weeks for a product to achieve its desired effect. Also, when you switch out a few products at a time, you don't actually know what's working or what's not working. What you really need is just a simple skin regimen of a good cleanser, moisturizer, and sunscreen. I would stay consistent with this for at least several weeks before making any changes. And if you do want to make a change, I would only change one product at a time. The number 6 mistake is over-exfoliation. It seems like everywhere you turn, when we get into our 30s and 40s and older, there's so many products and devices designed for harsh exfoliation. Mild exfoliation on a consistent basis, for example with a salicylic acid wash, is fine, but over exfoliation such as mechanical with a brush or strong acids or multiple treatments can leave your skin irritated and dry and is a perfect setup for an acne flare. Number 7, the last thing I want to mention, which is the most important step, is knowing when it is time to visit your doctor. There are products over the counter which will help acne. However, if your acne is cystic and severe, if it's hormonal or is starting to cause hyperpigmentation and scarring, it is time to see your doctor. You may need some blood work checked to see if everything is normal. So I've made a large list of some very important tips for you to have, and more importantly, a list that you can take to your doctor to make sure that everything is checked. This is so helpful when treating acne, and so I'll leave a link below for you to get this list. I hope you enjoyed this, and I hope it helps. See you next time. Remember, stay well and stay beautiful.